Good morning. Today's topic is about forensic odontology. So the forensis is a word which is derived from Latin, which means public, and forensic science deals with the identification of a person, or a dead person can be a living person, using various techniques. Forensic odontology is something very much related to dental field. It is a branch of forensic science which deals with collecting, preserving, recording and interpretation of the dental evidence at the interest of court of law to offer law enforcement. This forensic odontology has a lot of scope in the human identification, where methods like bite marks. Bite marks are nothing but the marks created from the teeth on a victim or on a suspect or on any non-living object. So study of these bite marks is included in forensic odontology. Also rugoscopy, that is the marks produced from the palatal rugae, which are also one of the unique features. And then photographs, the dental photographs of the dentition are also produced for forensic odontology studies. And then lip prints. Lip prints again gives us a unique identification of a person. So all these are used for identification of individuals in any of the mass disasters or any crime scenes. We are going in detail about the bite marks. So a bite mark can be defined as the physical end product of a complex set of events that occur when human or animal teeth are applied to the skin or foodstuff. And these bite marks include the marks that are produced from the teeth as well as the other surrounding structures. The crimes mostly involved in the bite marks include violent crimes, child abuse cases, sporting events, self-inflicted bite marks, and at the scene of crime. These are various crimes that are involved in the bite marks. So based upon the location of the bite marks, that is location of the bite mark on the body of a person, these bite marks can be categorized into non-sexual marks and the sexual marks. So most of the non-sexual marks will be present on any of the peripheral parts of the body, whereas the sexual marks are mostly present within the private parts of a person, and also can be possibly present on the areas like thighs, areas like neck, and few of the private parts which can be categorized into the sexual marks. There is also classification given for the bite marks, where McDonald's classified them into tooth pressure marks, that is the marks produced only due to the pressure from the tooth, and tongue pressure marks, where the marks will be present because of tooth as well as the pressure from the tongue. And tooth scrape marks, in case of violent crimes, mostly because of the movement of the individual, the marks can be actually scraped off from the tooth, so they appear to be tooth scrape marks. And then there are complex marks, which includes the marks produced from the teeth as well as the other structures, and which are with more intensity, leading to lacerations with on the surface on which these marks are produced. So here we can see clearly how a bite mark appears. So this mostly appears in the form of a crescent shape, sometimes maybe an ovoid form, and these bite marks include both the teeth of the maxillary arch as well as the mandibular arch. So mostly the bite marks will be seen from canine to canine, that includes canines, lateral incisors and central incisors, as seen in this picture of the maxillary arch and those of the mandibular arch. Okay, sometimes even the marks of the first premolar teeth can also be seen in this. And then in the center of this bite mark we can see an erythematous area, that is nothing but the petechial hemorrhage that is produced because of the pressure on the surface caused from teeth as well as from the tongue or other supporting structures that are present. So the pressure causes a petechial hemorrhage underneath the skin that appears as erythematous mark at the site. And then comes the recording of the bite mark. So in any crime scene, As we see the bite marks, its recording is very important. If we are recording the bite marks from a dead body, okay, so then the recording should be done before the removal of dead body from the scene of crime. Whereas for suppose if we are recording the bite marks from a suspect, then first and foremost thing to do is to take the consent of that suspect, and then we can record the bite marks using various techniques or various procedures. So how we collect these bite marks, be it from a suspect, be it from a victim. So how we collect this is also very important. We can collect the bite marks either through collection of swabs, that is the collection of saliva by swabbing technique from the site of bite mark, and then visible light photography, that is we can use the photography, different photographic techniques in order to get a bite mark photograph. Okay, and this photograph can be taken from various angles. One from the very much closest shots at 90 degrees angle to the location, and one from the long shot to know the exact location of that particular injury, and then one under the flashlight, one with no flashlight, one as previously there used to be no digital camera, so they used to take using two different cameras, one a black and white photograph and one a color photograph, but now using the digital cameras we can obtain both the types of radiographs for comparison. And the other techniques used includes non-visible light photographic techniques. These are mostly used whenever there is no clear bite mark or clear injury that we can clearly analyze using just a photograph. So when we can't do that, when it is very the injury is very light or which is difficult to analyze, in such situations we use infrared light or ultraviolet light photography and alternate light imaging techniques, which are together called as non-visible light photographic techniques. Next is bite mark impression. So this is also used in order to analyze the bite marks and collection of the bite marks. So in this technique we use various impression materials to get the impression of that bite marks, which and the materials used includes polyvinyl siloxanes, which is one of the alginate type of impression material. So these can be collected either from the living surfaces or from any non-living surfaces like foodstuffs or some rubber wood structures from where we can see the bite marks. We can collect these from that sites. Okay, to get a bite mark impression, first the impression compound is to be applied onto the site of bite mark, and then a cotton swab is placed onto it and leave till the impression material is set, and then the impression material is taken carefully from that site, and then the casts are produced from the impression material using stone, dental stone. So now the analysis of these cast models or the analysis of the bite marks. So after collection of evidence from the suspect by using impression material, that is impression from the dental arch, or by 3D scanning technique of the dental arch. So from the asset, before collecting the evidence from the suspect, we have to first take the consent of the suspect. After taking consent, we can either take the impression of the dental arch of the suspect, or we can do 3D scanning of the whole dentition, and we can also take the photographs of the dentition of that suspect in various angles again, in the lateral angles and in the direct angles. So after collection of all these evidences comes the analysis of the bite marks, so which includes odontometric triangle method, where 3 points are placed either using this is an X-ray which is shown here. We can use an X-ray, or we can use a cast model, or we can also use a photograph which shows the exact size and shape of the dentition. So on it we can make 3 points which forms a triangle, and which is used to measure the to analyze the dental arch measurements. And next is the comparison technique. This comparison technique can be direct, that is directly the dental arch, the cast that is produced from the dental arch can be directly compared with the photograph of the bite mark, or can also be directly analyzed from the bite mark seen on the suspect or on the victim. So the next method is image perception software procedure, that is these either cast models or the dental bite mark evidence that we got can be, the details can be uploaded to a software procedure which analyzes by itself and gives the measurements. There are also few special methods that I used, which includes Vectron method. Vectron is nothing but a kind of some calipers where it measures the dental arch size, shape and various other measurements, and a stereometric graphic analysis where it gives a map of the contour of the dental arch of the suspect. Next is scanning electron microscopic analysis. So this is the microscopic analysis of the bite mark wounds. Okay, so these are the other special methods used to analyze the bite marks. So here we can see the graphical analysis in this picture. So using all these, using the evidences that we got from the suspect, evidences that we got from the victim and the site or the scene of crime. So using all these and getting the analysis of all these, so finally the ABFO conclusions are used to categorize these bite marks into one of these categories. So these conclusions includes exclusion category, excluded. That means where the evidence that we got is not at all relevant to the bite mark. Okay, it is completely excluded. And then inconclusive, though there is a possibility that it could be a bite mark injury, but we can't exactly make sure whether it is a bite mark injury or an injury caused because of something else. So that is inconclusive. Next is possible biter, that we can see the size or form of the bite mark there, but because of some other pressure marks, other scrapings or some other injuries inflicted due to something else upon that bite mark, we can't exactly get the evidence from that bite mark. So that is a possible biter. Next is probable biter. Probable biter is we are almost 80 to 90% sure that it is a bite mark with a very slight amount of doubt. Okay, that is a probable biter. Reasonable medical certainty, which we can call it as a definitive mark. That is we are very much sure that it is completely a bite mark, a clear bite mark. So to get all the evidence, to collect all the evidence, to analyze it and to get to the conclusion, there will be also various difficulties that we face. Those includes subjective element in fabrication, that is in the fabrication of the exact bite marks. Okay, bite mark evidence, there will be subjective elements included, and the subjective element in comparison, there might be some problem with the during the comparison of these evidence that we got. And then distortion through skin elasticity, anatomical location and body positioning is one of the recurring problems. That is, for suppose it's been too late as the people reached the crime scene, so the body might have got decomposed or the bite marks might not be that clearly seen, so because of the distortion of the skin already or the distortion of the any foodstuff already. Okay, so this may lead to improper data. And then loss of data and contamination of the site where we are supposed to collect the data. So all these are the various difficulties we encounter in collecting the bite mark data. So that is about exactly what are different types of bite marks, in which conditions we do see these bite marks, how do they appear, and how to collect those, analyze those and conclude regarding the, and which can be probably used as one of the very most important evidence in forensic odontology. Thank you.